The thyroid gland, a small butterfly-shaped organ located in the neck, plays a vital role in regulating various body functions. Despite its size, the thyroid has a significant impact on overall health, particularly in females, where hormonal fluctuations and life stages can make them more prone to thyroid issues. Understanding thyroid symptoms, their causes, and the treatments available is crucial for timely diagnosis and management. Understanding the thyroid gland in its role. The thyroid gland produces hormones that regulate metabolism, energy levels, and many critical bodily functions. The two primary hormones, triiodothyronine, T3, and thyroxine, T4, influence heart rate, body temperature, and the rate at which the body converts food into energy. These hormones are controlled by the pituitary gland through the release of thyroid-stimulating hormone, TSH. Any imbalance in thyroid hormone levels can lead to noticeable symptoms and health complications. Signs and symptoms of thyroid disorders. In females, thyroid disorders manifest differently, depending on whether the gland is overactive, hyperthyroidism, or underactive, hypothyroidism. Women are 5 to 8 times more likely than men to develop thyroid problems, often due to the interplay of hormonal changes during puberty, pregnancy, and menopause. 1. Hypothyroidism symptoms. Hypothyroidism, or an underactive thyroid, occurs when the gland produces insufficient thyroid hormones. Symptoms can be subtle at first but often become more noticeable over time. Common signs include 1. Fatigue. Persistent tiredness even after adequate rest. 2. Weight gain. Unexplained weight increase despite no changes in diet or activity levels. 3. Cold intolerance. Increased sensitivity to cold temperatures. 4. Dry skin and hair, brittle nails, hair thinning, and flaky skin. 5. Depression and mood changes. Feeling down, irritable, or less motivated. 6. Constipation. Slow digestion leading to infrequent bowel movements. 7. Menstrual irregularities. Heavy or prolonged periods, menorrhagia, or missed cycles. 8. Memory issues. Difficulty concentrating or brain fog. 9. Swelling. Puffiness in the face or hands, particularly around the eyes. 2. Hyperthyroidism symptoms. Hyperthyroidism, or an overactive thyroid, is characterized by an excess of thyroid hormones in the body. Symptoms include 1. Unexplained weight loss, despite a healthy appetite. 2. Increased heart rate, palpitations or rapid heartbeat, tachycardia. 3. Heat intolerance, feeling excessively warm in normal temperatures. 4. Anxiety and nervousness, a heightened sense of unease or restlessness. 5. Tremors, shaking hands or fingers. 6. Insomnia, difficulty falling or staying asleep. 7. Excessive sweating, increased perspiration unrelated to activity or weather. 8. Thinning hair, hair loss or brittle strands. 9. Menstrual changes, light or irregular periods. 3. Thyroid nodules and goiter symptoms. Sometimes, the thyroid gland can develop lumps, nodules, or become enlarged, goiter. Symptoms depend on the size and activity of the thyroid. 1. A visible swelling in the neck. 2. Difficulty swallowing or breathing if the goiter presses on the esophagus or windpipe. 3. Hoarseness or changes in voice. 4. Sometimes, nodules may produce excess thyroid hormones, mimicking hyperthyroidism. 4. Autoimmune thyroid disorders. Women are more susceptible to autoimmune thyroid conditions, such as 1. Hashimoto's thyroiditis, an autoimmune attack on the thyroid, leading to hypothyroidism. 2. Graves' disease, an autoimmune disorder causing hyperthyroidism. Causes of thyroid disorders in females. Thyroid imbalances in women can be attributed to various factors, including genetics, lifestyle, and hormonal fluctuations. Here are the common causes. 1. Hormonal changes. Women experience unique hormonal changes during their lifetime that influence thyroid function. 1. Pregnancy. Thyroid hormone demands increase during pregnancy, and postpartum thyroiditis can occur after delivery. 2. Menopause. Hormonal shifts can unmask or exacerbate thyroid problems. 3. Menstrual cycle. Irregular periods or heavy flow can signal underlying thyroid dysfunction. 2. Autoimmune diseases. Autoimmune conditions are a leading cause of thyroid disorders. 1. Hashimoto's thyroiditis causes the immune system to attack the thyroid, reducing hormone production. 2. Graves' disease stimulates excessive hormone production by the thyroid. 3. Iodine deficiency or excess iodine is essential for thyroid hormone production. Both insufficient and excessive iodine intake can disrupt thyroid function. 4. Genetics. A family history of thyroid disease increases the likelihood of developing similar conditions. 5. Stress and lifestyle factors. Chronic stress and poor diet can contribute to thyroid imbalances, as stress affects the hypothalamus-pituitary-thyroid (HPT) axis. 6. Medications and medical treatments. Certain medications, such as lithium or amiodarone, and treatments like radiation therapy can interfere with thyroid function. Diagnosing thyroid disorders. Early diagnosis is critical to managing thyroid disorders effectively. The diagnostic process typically involves 1. Medical history and physical exam. A doctor may examine the neck for swelling or lumps and ask about symptoms. 2. Blood tests. Measure TSH, T3, and T4 levels to determine thyroid function. 3. Antibody tests. Check for autoimmune markers to identify Hashimoto's or Graves' disease. 4. Ultrasound or imaging tests. Assess the size, shape, and presence of nodules in the thyroid gland. 5. Radioactive iodine uptake test. Evaluate how well the thyroid absorbs iodine to differentiate between types of hyperthyroidism. Treatment options for thyroid disorders. Treatment depends on the specific condition, its severity, and the underlying cause. Here's an overview of available options. 1. Hypothyroidism treatment. The goal of treatment is to restore normal thyroid hormone levels. Common approaches include 1. Levothyroxine, a synthetic T4 hormone replacement taken daily. 1. Regular blood tests help adjust the dosage. 2. Dietary adjustments. Consuming iodine-rich foods like seafood, eggs, and dairy, or taking iodine supplements if deficient. 2. Hyperthyroidism treatment. Hyperthyroidism can be treated through several methods. 1. Antithyroid medications. Drugs like methimazole or propylthiouracil reduce hormone production. 2. Radioactive iodine therapy. Damages the thyroid to reduce hormone output, often resulting in hypothyroidism, which is easier to manage. 3. Surgery, thyroidectomy, partial or complete removal of the thyroid gland in severe cases. 4. Beta blockers. Relieve symptoms like rapid heart rate and tremors without addressing hormone levels directly. 3. Goiter and thyroid nodule treatment. Treatment varies depending on the size and activity of the goiter or nodules. 1. Monitoring. Small, non-problematic nodules are often observed over time. 2. Surgical removal. Large or cancerous nodules may require surgery. 3. Radioactive iodine. Shrinks an overactive goiter or nodules. 4. Lifestyle modifications. While medical treatment is often necessary, lifestyle changes can complement treatment. 1. Balanced diet. Incorporate selenium, zinc, and iodine-rich foods. 2. Stress management. Yoga, meditation, or counseling to manage stress, which impacts the thyroid. 3. Regular exercise. Boosts metabolism and energy levels. Complications of untreated thyroid disorders. Ignoring thyroid symptoms can lead to severe health issues, including 1. Heart problems. Increased risk of cardiovascular disease with untreated hyperthyroidism or hypothyroidism. 2. Infertility and pregnancy complications. Thyroid imbalances can lead to difficulty conceiving or complications like preterm delivery. 3. Myxedema. A rare but life-threatening condition caused by severe hypothyroidism. 4. Osteoporosis. Accelerated bone loss from untreated hyperthyroidism. Preventing thyroid disorders. Although not all thyroid conditions are preventable, some measures can reduce the risk. 1. Adequate iodine intake. Ensure sufficient iodine in your diet without overconsumption. 2. Regular checkups. Periodic thyroid function tests, especially if you have a family history or risk factors. 3. Stress management. Minimize chronic stress to support overall hormonal health. 4. Healthy lifestyle. Balanced nutrition and regular exercise contribute to optimal thyroid function. Thyroid symptoms in females. A growing awareness of the prevalence of thyroid disorders in women highlights the importance of awareness and education. Since the symptoms can mimic other conditions or go unnoticed, understanding the early warning signs and seeking prompt medical advice can make a significant difference. Conclusion: thyroid disorders in females, whether hypothyroidism, hyperthyroidism, or autoimmune related, can have profound effects on physical and emotional health. Recognizing the symptoms, understanding the underlying causes, and seeking timely treatment can improve quality of life and prevent complications. With the right combination of medical care, lifestyle changes, and awareness, managing thyroid health is entirely possible. If you're experiencing symptoms or have concerns, consulting a healthcare provider for a thorough evaluation is the first step toward effective management.